My name is Taoheedah Abdul Karim. I have 5 years experience in community health projects and I align with viral hepatitis and HIV, and I've been able to carry out health advocacy across grassroots community in Nigeria. I'm the founder of Health for All Initiative for Community Health. I build this NGO, non-governmental organization, purposely for health promotion programs and interventions in Nigeria to basically eliminate public health threats such as HIV and viral hepatitis. What made me become an advocate for hepatitis was due to a personal experience. Towards the end of my undergraduate, I needed to experience what lab diagnostic is all about, to understand how testing is being done, understanding that I have passion for public health. This is why I volunteered myself at a private hospital here in Nigeria to work as a lab assistant in 2023. So during my work as a lab assistant in 2023, I diagnosed a pregnant woman with hepatitis B, and this was the first time I had this personal experience with hepatitis B. As an health worker at that particular period of time, knowing that I am a risk factor for hepatitis B, I was encouraged by my supervisor, the medical laboratory scientist who was in charge of what I was doing then in the lab, to take hepatitis B test. So after I took this test, I realized that I was negative. Subsequently, I went to vaccinate myself against hepatitis B. So this was what made me an advocate of hepatitis B, and what I did afterward was that other health workers who was also working at that hospital, I made sure I sensitized them and I encouraged them to go for their hepatitis testing and vaccination. Ever since then, I've been carrying out various projects on hepatitis, such that beyond myself, I also encourage my parents as well to go for their hepatitis testing. Hepatitis is just the inflammation of the liver, and it can be caused by different factors. So what happens is that when the liver is being inflamed, as time goes on, it leads to total damage of the liver, and this is what results to liver cancer. So what can be prevented in such a case that viral hepatitis will not lead to liver cancer is for people to go for their hepatitis testing, most especially pregnant women. When they are tested negative, they should be vaccinated immediately, and when they are tested positive, they should not see that as a stigmatization. They should instead go to the primary healthcare center and standard hospital to commence their treatment. The reason why screening of hepatitis B is very, very important is that, like I said earlier, according to the data of the World Health Organization and other health organizations in Nigeria, over 20 million people are living with viral hepatitis. And like I said earlier, if they are not tested, they do not know whether they are positive or they are negative. So I look forward to a Nigerian where people can freely talk about hepatitis B, way forward to go about it, involving the government, the traditional leaders, the students. Everyone should be well vaccinated and should be well equipped with necessary things to know about hepatitis.